Welcome back. St. Barnabas Hospital Health System has been selected as one of the 13 recipients of the newly launched Mother Cabrini Health Foundation's $51 million nursing initiative, a landmark investment aimed at strengthening nursing excellence, reducing burnout, and improving patient care across New York State. Here to tell us more is the Senior Vice President of Chief Nursing Officers for SBH Health System, Robert Church, and the Director of Nursing Education and Professional Practice for SBH Health System, Dr. Nichola Watkins. Thank you both so much for joining us today.
Thanks for having us. This is great.
I'm so excited to talk about this initiative and this grant. It is something that I think is so important. I have so many friends and family members who are nurses, so yes. I'm so excited to talk about this topic. So just to start off, can you tell us about this $5 million award and what this is going to mean for your hospital and your nursing staff?
Sure. So, a lot of gratitude to Mother Cabrini Health Foundation. They did a study and they looked at safety net hospitals, which are hospitals that serve a very, underserved and poor communities. And they wanted to see, was the standard of nursing care the same there as it was in other hospitals? And they found out that it really wasn't. Mm-hmm. So they presented this grant opportunity to allow us to go for Pathways to Excellence, which is really going to help improve the quality, the safety for patients in the community that come to St. Barnabas, but also improve the working conditions and the well-being of the nurses who work there.
That's amazing. Congratulations.
Thank you.
Of course. So now tell me, for viewers who may not be familiar with the ANCC Pathway to Excellence designation, why is it so significant for a hospital like SBH?
This is a very significant award. The American Nurses Credentialing Center is a credentialing body for nursing within the U.S., and they have programs such as Pathway to Excellence and Magnet, and our facility decided to go for Pathway to Excellence. So this designation for Pathway to Excellence does enable a facility to continue on a journey of nursing excellence. This allows and indicate that the hospital has a positive work environment for our nursing staff, which does exemplify the care that's being provided to the patients.
Mm-hmm. And so, we're hearing more about burnout in healthcare, especially post-pandemic. Mm-hmm. So tell us, how does a structured residency and mentorship model help reduce burnout and retain new nurses?
So not only does the grant allow us to go for Pathways to Excellence, but it also allows us to expand what's called our nurse residency program. Mm-hmm. So nurse residency program is different than orientation, right? A lot of hospitals just have a hospital orientation that you go through, you learn your policies and procedures, and you're out on the floor. A nurse residency program gives you an extra year of mentorship, and it also gives you exposure on how to do like an evidence-based project and research for something that's specific to the unit that they're working on. So prior to this, we only had a nurse residency program for our emergency room nurses and our critical care nurses. Thanks to this grant, we can now expand that to all areas of the hospital, including maternity, psychiatry, med-surg, surgical services. It'll be house-wide.
Can you tell me, from your perspective, how has that benefit the nurses? Maybe specific feedback that you've learned?
Yeah, well, like you said, especially during COVID, a lot of the people coming out of schools didn't get the same clinical time they did in the past. So this residency program gives them the extra support and education and mentorship to help them kind of get established. So if a nurse can make it through the first year, their retention is more likely to continue at the hospital. Not they're not going to get frustrated and leave and go somewhere else.
So essentially, you would say like the first year is the hardest.
The hardest part, absolutely.
Yeah. And so, in that, this grant also helps to address the nursing shortage and help its workforce and address generational turnover. So can you speak to how SBH specifically plans to grow and support its nursing workforce over the next 5 years?
Yep. So even prior to this, we were one of the few hospitals that would hire new graduate nurses right out of school. So we're continuing to do that. This grant, obviously going on the journey for Pathways to Excellence, is going to really improve the environment that they're going to work in. The residency is going to help. We work in collaboration with 1199, which is the union at our hospital. And together we fund something called the training fund, which gives nurses access to education specific to the specialty that they're working in.
That's amazing. Yeah. And so tell me, how will the patients at SBH feel the impact of this investment? A lot of times they hear that the staffing ratios aren't the best or things that are causing, patient impact. So just tell me a little bit about how they'll notice this care in their experience.
Sure.
Well, when it comes to a Pathway to Excellence facility, in order to start the journey, a facility has to have shared governance.
Mhm.
And that allows our nursing staff to have shared decision making, basically like having a seat at the table. And that influence the care that's being provided. So they have a say in the care.
Mhm.
So this will also impact our patients because the nurses will have involvement in meetings, will have involvement in the care that's being provided to them. And it overall does improve patient care.
Absolutely. And now tell me, you mentioned earlier that SBH is a safety net hospital. So can you mention a little bit about why it's so important to have programs and resources like this for a hospital like SBH?
Sure. So, being a safety net hospital, like our payer mix is very heavy on Medicaid and Medicare. So we don't get the same reimbursement that, more suburban hospitals would get. So we were never able financially to set up a model like shared governance, which is what this Pathways to Excellence takes us to. So by getting this grant in over 5 years, it's going to allow us to create this culture. And if there's anything you take away from the whole Pathways to Excellence, the whole premise is that it's going to improve the quality, it's going to improve the safety, and more importantly, it's going to improve the nurses' work environment. So like Nichola was saying, staff now get a say, right, in how things are getting done. And that's the part that was always missing. Our staff always stayed at the bedside. We never had the opportunity to have them involved in councils and committee meetings. So by them being involved, the idea is that they're going to enjoy their workplace, they're going to have a better work environment, and then that transfers to the patient. So if you have a happy nurse, you're going to have a happy patient.
Amazing. And so I'd love to hear from both of you on this. This is a 5-year investment. So at the end of these 5 years, where do you hope to see the nursing staff at SBH?
So it is. It's not overnight. It's going to take 5 years to get to where we need to be. First thing we have to do is start to educate the staff about what is shared governance, what is shared decision making. Then we set up these councils. So there'll be like a nursing practice council, there'll be a nursing policy council, there'll be a nurse research council, there'll be a lot of different councils that the staff are eventually running those councils. So when a problem arises, right now pretty much we say, here's a new policy, right? Learn it and follow it. Now the staff get to be involved. They get to look at, what actually happened, right? So if there was an incident, what was the incident? They get to decide what's the best nursing practice to improve and prevent that from happening again. So that just deep involvement will help them understand it and buy into it much more. At the end of the 5 years, we hope to have this culture in place. The actual accreditation from ACN for Pathways to Excellence, that's just validating all the work that we've put into it. And that's our goal, is to get that. But it's validating that we've created this culture and a work environment for the nurses to thrive in.
That's amazing to hear. Dr. Watkins, what about you?
I had the opportunity to go through the Pathway to Excellence journey with another organization and to see the impact that those 6 standards have on the nurses: shared decision making, leadership, safety, quality, well-being, and their professional development. To see how that has impacted the nurses, and they're having that involvement and being a part of the process to improve patient care within the facility was absolutely amazing. It does improve their recruitment and retention, and they're wanting to stay, they're wanting to be more involved. So to see that transformation is absolutely beautiful. And to see that journey that we're going on with SBH Health is going to be wonderful for the nursing staff, for leadership, and overall our patients.
I love that you mentioned that, because I was just going to ask you on how achieving this pathway to excellence will improve the culture of SBH and its nurses specifically.
Yeah.
So tell me a little bit on what are some things that for lack of a better word, that would ruin the culture in this particular field?
I guess to ruin it is if there's no buy-in to wanting to do this. But we're just making the nurses understand this is for you. This is for them, their development, meeting those 6 pathway standards. And this is overall the improvement of the care we do provide to our patients. So this is that development for them personally. And it's something that any nurse will want to be a part of.
Yeah, actually, studies have shown that hospitals that achieve Pathways to Excellence, the nurses feel they're valued, they feel they're inspired, and they feel they're empowered. And that's exactly the culture we're trying to create.
Exactly.
I was just going to say, again, I'd love to hear from both of you. What excites you most about this new grant and this new program?
I think the thing is that this, we now have an opportunity to get the staff involved, right? And it's something we've always wanted to do. But now the staff, they get to decide what the professional nursing practice model is going to look like. So that's exciting.
It's like I said, I've seen the process of this and the resulting and the journey of it, putting those standards in place and improving what's already in place. It's definitely a welcoming thing. And it does help when new nurses or our nursing students who do come and do clinicals at our facility, they'll see that change, or they'll see these processes in place, and then they're going to say, well, I want to work there. So it does help with our recruitment.
Yeah, absolutely. And now we do have a little bit of time left in the segment. I just want to talk maybe on how the culture has shifted since the pandemic that you mentioned earlier at the top of the interview, and how, in nursing as a whole, you kind of want to work to get it maybe back to where it was before COVID.
Yeah, I think the biggest shakeup from that was the number of nurses that left the profession. And for a time being, nurses were not enrolling into nursing school either. That's coming back. So now, you're seeing the school enrollments go up. You're seeing nurses who left coming back. And it's these kinds of environments that are going to help support that.
Absolutely. Yeah, and just lastly, just to wrap up, for anybody who's watching who may want to become a nurse and is thinking about the profession, what's some advice that you have for them?
So that's my favorite question, and I can talk about it all day because when I became a nurse, 1989, right? Only 3% of all nurses were male back then, but when people ask me why choose nursing, because you can do anything, right? You can work with the very young, newborns, all the way to geriatrics. You can work in primary care. You can work in an emergency room or an ICU. You can work, in an OR, or you can work in IT, right? So one of the growing fields in nursing is IT. So people who are very much into computers, you need the nursing knowledge to apply it to the IT. So now, every hospital has electronic medical records, right? Well, nurses develop those. Nurses create those so that the workflow follows the nursing pathway. So once you go to nursing school, there are endless opportunities. You can see, blood and guts, never see blood at all. I mean, the spectrum is everything.
And for me, being a part of this profession has been an amazing opportunity. I've been a nurse for 20 years now. And from the opportunities that a new grad will see to what they can do, saving a life, going through the pandemic, thank God we're out of that now, but seeing the other side of it and improving overall patient care and these services that we do provide to patients, from a safety net hospital to any level of hospitals. It's an absolute wonderful profession to be a part of.
Absolutely. I want to thank both of you for sitting down with us today. I mean, nursing is just such an amazing, amazing profession. What you guys do every single day is just unexplainable. So thank you so much for sitting down with us today.
Thank you for having us.
To learn more about the efforts being made by SBH Health System, please visit the website on the screen below. Stay tuned. We have more open right after this.